Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
Varicose veins, you know, those gnarled, enlarged veins that usually show up in your legs and your feet? Well, that's because standing and walking upright increases the pressure of the veins in your lower body. And for a lot of people, varicose veins and spider veins, which are a common mild variation of varicose veins, they're simply a cosmetic concern. You don't like the way they look. And I don't know of anybody who thinks those big, ugly veins are that nice.
If only we did.
Yeah.
For other people, varicose veins can cause aching pain and discomfort, and sometimes varicose veins lead to more serious problems. Here to discuss treatment options for varicose veins and maybe a little bit more than that, Mayo Clinic vascular surgeon Dr. Peter Gloviczki. Welcome back to the program, Dr. Gloviczki. Good to have you here.
It's a pleasure to be here with you.
And, you know, we're lucky to have you here because you're sort of in the twilight of your career. And didn't you just tell me that this is your last day or tomorrow is?
This is my last day.
Oh, wow.
It's a good thing
what
we got him
What a
booked.
send-off. Yeah.
All right. Well, in all of your career, what have you learned about varicose veins? And is that the number one thing people ask you about?
Well, this is a very frequent thing that people are asking me about because varicose veins are one of the most prevalent medical disorders. There are more than 25 million American adults who have varicose veins.
25 million.
25 million.
What
And
percent are women?
And it's a little bit more frequent in women than in men. In younger people, it is more frequent in women. In older people, it's more frequent in men.
Is it just a cosmetic concern, or is there actually a problem?
It is frequently a cosmetic problem because, as you said, it's a spectrum of problems from spider veins, telangiectasia to varicose veins to advanced chronic venous disease, which includes, unfortunately, venous ulcers, which lead to pain, disability, loss of working days.
You know, I think another concern for people who have enlarged varicose veins, they're concerned about a blood clot. Is that a complication of varicose veins or no?
Blood clots are complications of large varicose veins, and there are two types of blood clots. One is what we call superficial thrombophlebitis, and that is more frequent in varicose veins. And the other one is deep vein blood clots that have a lot of other etiologies, but varicose veins is among them.
But you don't have the potential complications with the clots in the varicose veins that you could potentially have with a thrombus or a clot in the deeper vein, right? Where it could potentially go to the lung and actually take your life.
Actually, you do, but it's rare.
Yeah.
But some advanced superficial phlebitis, we treat it like they were deep vein thrombosis, really just to prevent a life-threatening blood clot in the lungs.
And how during the course of your practice have you changed in your treatment of varicose veins?
Treatment has been revolutionized in the last decade or so.
What did you do in the beginning of your practice when someone had varicose veins?
Well, open surgery has been and continues to be a major part of our treatment of venous disease, and that's what we have been doing from the beginning, surgically remove varicose veins, either what we call phlebectomy, which are small incisions to remove individual varicose veins, or a procedure that is a little bit more invasive than the currently used techniques. It's called the stripping.
And remember the two brothers, the two vascular surgeon brothers, wasn't it the Lofgren brothers? That's basically all they did, wasn't it? Strip veins.
The Lofgren brothers and Titi Myers, they really ran one of the world's largest vein clinic or vein center here in Rochester, Minnesota. But it's interesting to see that the Mayo brothers actually were very interested in varicose veins, and they published close to 300 varicose vein operation as early as 1906.
Wow.
And they even invented a certain type of vein stripper. So the Mayo brothers were very much involved in venous disease. And believe it or not, the very first operation at St. Mary's Hospital was a patient with varicose vein surgery.
Is that right? And then, but back in those days, you were doing vein stripping or actually removing the vein through incisions.
Yes, but actually the stripper that the Mayo brothers invented, Charles Mayo specifically, enabled you to make two small incisions, and with the help of this stripper, remove the entire vein that was under the skin between these two incisions. So it was actually revolutionary at that time.
We're bouncing back and forth between the beginning of his practice and what the Mayo brothers were doing. Those two things not at the same time. Let's just be clear about that, right?
That is correct.
I mean, you've been here a long time, but not back when the Mayo brothers were working.
That is correct. And actually the revolutionary change in the last decade or 2 decades have been the minimally invasive endovascular treatment of varicose veins with laser and radio frequency.
So that's how people are treated now?
This is how people are treated now. It is called endovenous thermal ablations.
And tell us about that. How do you do
Well,
that?
this is done actually as an office procedure. It is done without an incision, just percutaneously with a
Through the skin.
Through the skin, just with through a small catheter. You insert the catheter into the saphenous vein, which is the main vein of the superficial system. That is frequently the only vein that's responsible for the varicosities, but of course the branch varicosities need treatment as well. But the saphenous vein treatment is done with this percutaneous technique without an incision under what we call tumescent local anesthesia. And these veins are sealed by the heat of the catheter that is inserted. And
They're burned?
And they're burned. That's exactly the right way. That's why it's called endovenous thermal ablation.
Thermal, meaning heat. Yeah.
Meaning heat. So the laser fiber warms up to close to 1,000 degrees, and the radio frequency fiber is heated up to 120 degrees centigrade.
Should everyone get their varicose veins treated, or is it just for cosmetic purposes you do that?
Of course, not everyone should have their varicose vein treatment treated. I think there is a great debate, and we just recently participated in a great Medicare debate with MedCAC, which is an agency that actually advises reimbursement for Medicare patients, because there are 25 million Americans who have varicose veins. Now, if you treated everybody, that would really be such a huge expense that the country's healthcare system couldn't afford it. So there are specific indications to treat patients with varicosities and those who have more advanced chronic venous insufficiency.
And the for sure indications for treatment are?
And for sure indications are symptomatic varicose veins.
So they're painful.
They are painful, although again the pain is something that is subjective. So the real for sure indications are those that have advanced disease with visible evidence of more advanced chronic venous insufficiency, which includes skin changes, edema, history of phlebitis, history of bleeding, and venous ulcers.
All right, and edema is swelling. Well, it's so good to know that you've made so much progress in the field of varicose veins. Nice job. You can retire.
We've been talking with Dr. Peter Gloviczki about treatment for varicose veins. We're going to take a short break.
When we come back, we'll switch gears and we'll hear about Dr. Gloviczki's personal journey, how magic led to medicine, or at least had a major part in it. Dr. Peter Gloviczki coming up.
You're listening to Mayo Clinic Radio on the Mayo Clinic News Network.
Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
We are with vascular surgeon Dr. Peter Gloviczki on his penultimate day at the Mayo Clinic. Peter, tomorrow is the last day, but you have one of the greatest stories ever with regard to not only where you grew up, but how you got into medicine and how you got to the Mayo Clinic. Can you share that with us? This could be your last opportunity. Yeah.
Well, I went to medical school in Budapest, and there are a lot of reasons why I went to medicine, and one of the most important is that my father was a tremendous role model for me, and already at age 6, I declared it in the family that I would like to be a professor of surgery.
Is that what your father was, a professor?
My
of surgery?
father was actually an internist and a neurologist, but he had a good friend who was a surgeon. And so I wanted to be a little bit different than my father, but indeed stay in the profession
But
of
at the age of
medicine.
6.
You were 6 years old.
That's right.
Wow.
First grade.
That's right.
Yeah. Well,
And then, things went well, and I got into high school and medical school. And interestingly, on the way, I met a colleague of my father who was an amateur magician. And he gave us a magic show, and I tried to do some tricks, and he kind of realized that I am not only interested, but I have certain talent. So he became my mentor. And at age 14, I participated in a Star Search television competition in Hungary that was called the Hungarian Idol. And I got first prize.
Oh my goodness! What do you remember? What you won for first place?
Well, the first prize was that we were allowed to attend a World Youth Festival in Finland, Helsinki.
Oh my gosh!
And so I could perform for an international audience.
And you were how old then?
Age 14.
14. Okay.
And then I got into the medical school, and I certainly, I was looking for what's the area in surgery that I liked, and there was one position open at the cardiovascular clinic, and the vascular surgeon was a good friend of my father, and actually he took me, and after 2 weeks I really loved vascular surgery. So I did my residency, and then I got a scholarship to Paris. And I worked with a very famous professor, Professor Servel, who a couple of times during the year I spent there disappeared and came back and told us about his trip. And I asked him, "Where did you go, sir?" He said, "I went to the Mayo Clinic." I said, "Why
From
did
Paris.
you go to the Mayo Clinic?"
Yeah.
He said, "Monsieur, the Mayo Clinic is #1 in the world." So I thought, if the Mayo Clinic is #1 in the world, what am I doing in Paris?
That's right. Why wouldn't I be there?
Rochester's so much better than Paris.
And this is how I actually ultimately got to Rochester. I was just searching, and I found a physician, Dr. Alexander Schirger, who had some Hungarian relatives, and really took me under his wings. He got one of his patients came up with a scholarship, the Bestor brothers, and I became the first Bestor fellow. And exactly 35 years ago, in July of 1981, I started here as a research fellow.
The Brester brothers, I know them also. They're from Illinois, right?
That's correct.
Geneseo.
That's right.
And they actually provided the money to allow you to come here to do additional training.
That's right.
And Dr. Scherger was your mentor. A
That's
great
right.
guy.
Yeah.
Amazing story.
What about your the physician in Paris, your teacher in Paris? Was he impressed when you said, "I'm going to Mayo Clinic"?
He didn't know it at that time, but he certainly was impressed 10 years later when I met him at a meeting. I said, "Well, where are you, Peter?" He didn't remember my last name. Mm-hmm. And I said, "Well, I'm at Mayo Clinic." "Oh, you are at the Mayo Clinic." And since that time, I was his most favorite student.
Did you? Has there ever been a chance when you've used magic in your practice of medicine?
I actually
He's used some of it in my room, actually.
Has he really?
He's got some of the best hands I've ever seen. And every once in a while, I would get into trouble with a blood vessel, and Peter was always there.
Well,
I don't understand why he didn't remember your last name, though, because it's so easy to spell. Gloviczki. Gloviczki, huh?
God, that's perfect.
Yeah, no, he's wonderful. So tell us about that.
So my patients know it. My door card has a magic hand and a top hat. And interesting enough, when I became a named professor. I got the professorship that was made in honor of Dr. Ellie Beers, who, as you know, not only was a world-famous surgeon, but he was a very gifted magician.
What?
So we found
Are magicians and surgeons the one and the same here?
We found each other in magic, and actually we performed together with Dr. Beers at one of the meetings of the Minnesota Surgical Society, and that,
Launched your magic career.
magic helped me all along my life, everywhere.
It's pretty amazing. So tell us what you're going to do now. I mean, you retire tomorrow from your surgical practice, from the Mayo Clinic. You've been here, what, 30, how many years?
35 years
35.
and 29 on the staff. And I became the editor-in-chief of the Journal of Vascular Surgery, which is the main journal of vascular surgeons and the Society for Vascular Surgery. And that is something that I'm going to do hopefully in the next 6 years.
I'm imagining you down on the Peace Plaza or in local coffee shops performing magic. Are you going to be doing more magic now that you're retiring?
And I am sure that I'm going to do some more magic. I am a member of the Magic Castle, which is the largest private magic club in Hollywood, California. So when we travel to Los Angeles, we always visit the castle. And there are a lot of other projects.
So tell me about the last 35 years practicing medicine here at Mayo Clinic. What are some of the things that you're going to remember? Maybe fondly or maybe not so fondly. Let's go with the fondly.
Every day is a pleasure to work here. That's the way I can sum it up. This is an unbelievable place, where indeed people who are devoted to this profession, they should come and practice here.
Absolutely, and it sort of amazes me sometimes why everybody in the world doesn't come here for their medical care. I mean, and I'm not bragging. The Mayo Clinic is truly it's the integrated practice and the colleagues that you have and the teamwork that you have here. When you come to the Mayo Clinic, you don't just get a doctor, you don't just get a nurse, you get a team of people who are willing to and want to take care of you.
And that's absolutely true. I mean, there it is. Dr. Shives and myself, we have worked together, many times, and together we are so much better than just
But you know what?
One of us.
What he just said, you are retiring. It is, I know, hard for Dr. Shives to even think about retiring. Was this a hard decision for you?
Of course it was a hard decision. It's always a hard decision. And, everybody asks me, my patients are crying. They are asking me why I'm retiring. Yeah. But the fact is I'm 68 years old, and you must make a decision there is no right time. But I prefer to retire at a time when I think I am the best, and when I say that I retired, not when Dr. Shives asks me, how come you haven't retired yet?
Well, it's terrific. The thing about Dr. Gloviczki is he's smart enough that he can go on to be an editor of a journal, and that's a 50% position.
Absolutely.
Right? And so he's still going to stay busy and still going to stay completely involved. So it's wonderful. And you've had such a great career at Mayo. And I always love hearing the stories about how you got from Hungary to Paris to here. And you've continued to do the magic, which has been a hobby of yours for so long. How many magic shows you do a year, do you think?
Well, obviously, I do much less now than what I used to do, but I used to be pretty good, and I got a second prize at the World Championship of Magic in 1973 in Paris. and when I was a young surgeon in Budapest, that was the only way to come out to attend medical meetings, to arrange a magic show, get an exit visa as a magician, because as a physician, they didn't let me leave. It was a communist country.
Yeah. So you used magic to go to medical conferences?
Absolutely. Every time.
Wow. Dr. Peter Gloviczki, congratulations on your retirement, magician and master vascular surgeon. Really enjoyed having you on the program. Thanks, Peter.
Thank you very much.